right, the first head-to-toe care show of 2013.
There it is.
Dr. Riadh Fakhoury is in the studio. He, of course, is a chiropractic orthopedist and the owner of Fakhoury Medical and Chiropractic Center. And your questions are invited. It's January 2nd, 2013. And if you're listening to us on that date, if it's the same date where you are, then this is not a rebroadcast. Although Dr. Fakhoury doesn't usually do rebroadcasts. As you heard last week, it was a new pre-broadcast that he did while he was away. We'll find out where he went in just a bit because I'm nosy. But if you have a question for Dr. Fakhoury about your health, give him a call. If it's somewhere in your body and you need help, call Dr. Fakhoury. The number here is the WOCA Climate Control Source Hotline, 622-9622. Good morning, Doctor.
Good morning, Larry.
You had fun over the holiday, didn't you?
Oh, it was a lot of fun.
Did you go to Mexico?
That's where we went.
I thought I saw that, yeah.
Right.
Did you drink the water?
No. Bottled water.
No. Yeah.
I'm not taking any chances.
I always heard that. Don't drink the water.
Well, just changing from one location to another, your body needs some adaptation time, and that probably wouldn't be a good idea.
Yeah, you handle it well, though. I mean, you are a world traveler. I mean, you go a lot of places.
Well, it's just, there's so many places to see, so many people to meet, and just seeing the diversity of different places and different cultures, and it's a wonderful thing.
Can I ask you a personal question about that? How do you handle the language? I mean, do you study it before you go to each of these places, or are you multilingual? Do you know many languages?
No, but we use the international language.
English?
No, well, somehow you pick up a few words of the country you're in.
Okay.
And the rest just works itself out.
Okay.
Either that, or with Spanish, I'd have Manel next to me. I'd roll down the window and I'd say hola, and they'd start talking, and I'd say Manel.
Oh, Manel speaks Spanish fluently?
That's right.
Oh, wow. Oh, wow, so she speaks 3 languages.
She does.
Oh, my goodness. Holy mackerel.
Yeah.
And I only know that because of what we did with the Literacy Council. I knew that she was... her first language is Arabic. Am I right about that?
That's right.
Yeah, that's amazing. Really. Yeah. Even looks different, right?
It does.
So it's the new year. Are you having people showing up because part of what you do is in their New Year's resolution?
Well, that's true. Some people are wanting to make a change in their health, and other times it's that encouragement by being uncomfortable, by feeling pain, and people say, this is affecting my life, it's affecting my function, it's affecting my family, I need it to be taken care of. And they call on us to be able to try to give them an expedient form of treatment, good diagnosis, figure out what the problem is,
right,
and get it taken care of. Again, in the end, usually what encourages somebody to make a call to the Fakhoury Medical Chiropractic Center is usually some type of pain or maybe a trauma. They sleep wrong. This happens quite often, Larry, is that somebody will go to sleep fine and they'll wake up and they'll have a stiff neck, a wry neck. They won't have full range of motion. They may be bent to the side with the neck a little bit. And it's a little scary when you wake up and you can't move your neck. When you experience pain, a lot of time people are afraid and they're scared. They want answers. They want to know what it is, number one, and what I need to do to fix it and get back to the way I was before, because people want to go back to the way they were before. Now, in your question, people want to be better than what they were before.
Right,
so
right,
they'll come in because they want
right,
more flexibility, they want more range of motion, they want less pain, they want to be able to control their health and be in charge of it.
It's amazing how quickly something can go wrong and how getting it back to being right takes a while. Like, for example, you just mentioned going to bed, and a lot of people can relate to this. You go to bed fine, you wake up with a stiff neck or something, and it literally can take a day or more to get it back to normal.
It can, that's right. And the problem could have been building up over time, so it shows up today, but it might have been a problem that's been developing over months.
So maybe it appears to be quick, but it wasn't as quick as it appeared.
Correct.
All right, let's go to the phone. That's what you do the show for, and our listeners will have some questions for you. Let's go take a call. Good morning. You're on the air with Dr. Fakhoury.
Good morning, Larry. Good morning, Dr. Fakhoury. This is June. How are you? And Happy New Year to everyone.
Happy New Year to you also, June.
I have a question for you, Dr. Fakhoury. I've been undergoing my physical therapy for my shoulder.
Yes, ma'am.
And that's about over now. And I have been a patient in your office.
Yes, ma'am.
But you recommended not to do everything at once. And the physical therapy, even though I used to do it myself to my clients, doesn't seem to be working at all. And I'm wondering, and I will hang up after I ask this, do you or would you recommend a shot of cortisone, or would you recommend a anti-inflammatory pain stopper or something like that into my shoulder? And I'll hang up and listen, and I thank you for your advice.
Thank you, June. Thank you very much. June is a sweetheart. What she was saying is that she obviously had something happen to her shoulder, and not to keep some of the information confidential for her. And she's doing physical therapy for the shoulder, but she's hit a plateau, and and she knows where she wants to be, and she's not getting to that point. So the next step would be, June, to come in and let either Dr. Teeter, myself, or Dr. Hutchison evaluate that shoulder, because sometimes your plateau and the restriction or the limitation of moving forward could be a functional involvement somewhere else in your spine. For example, your neck may be out of alignment, your mid-back may be out of alignment, there might be a muscular imbalance, there might be something else functionally in your body that's not working properly, that's affecting you from taking it to the next step. So what we need to do is, before we go into the course of injection or the thoughts of injection, start with the most conservative and the simplest form of treatment. So if it is a matter of functional medicine where you're not balanced, or there's something else that's out of position that might be pinching, or a rib that's out of position, let's evaluate that first and relieve that pressure and see if that breaks your plateau and you can move forward with your home exercises. If it's more than that, then we can consider a Dr. Hobbs, an evaluation with Dr. Hobbs, and that's his level of expertise, and that's what he does, and that's all that he does. So he can sit with you and discuss that and let you know if he feels that reducing the inflammation and the pain through an injection in the joint under fluoroscopy or motion x-ray might be a better choice. But first step is, let's go more conservative and see if that takes care of it. If not, then step it up and let you visit with Dr. Hobbs at the Fakhoury Medical and Chiropractic Center to see what his recommendations would be.
All right. The number, if you have a question for Dr. Fakhoury, is 622-9622. It's the Climate Control Source hotline. Is inflammation usually the cause for pressure?
Inflammation is really a troublesome thing in our bodies. Inflammation let's talk about what inflammation is. It's a warmth. There's something going on in your body. There's heat that's being produced. There are enzymes, and there's chemicals that are occurring in that area that in this inflammatory process that could be destructive to the surrounding tissues. So basically, inflammation is important for us. It helps us with healing. It helps us with fighting viruses. It helps us with fighting bacteria. It helps in so many ways. But too much inflammation or a continual state of inflammation can cause damage. It can cause damage to blood vessels, it can cause damage to joints, it can cause damage to muscles. So it can be destructive because it is an inflammatory process. It's a fighting process of the body. The body's trying to fight something in there, and if it's limited, that's good, but if it's continual, that could be a problem.
So the anti-inflammatory almost stops your body from defending itself, but it eases your pain. Is that right?
It does. Sometimes we will recommend natural anti-inflammatory medicine using different digestive enzymes. Other times it needs more, and Dr. Shanawani, our medical director on staff, can write a prescription for an anti-inflammatory, reduce the inflammation so the healing process can take place.
All right, let's go back to the phone. Good morning. You're on the air with Dr. Riadh Fakhoury.
Yes, good morning, Dr. Fakhoury, and Happy New Year to you.
Happy New Year to you also.
And understanding that you're kind of like a world tour person getting around, would you say that the caliber of chiropractic medicine in different countries is up to the standards of ours, or vice versa? And do they do anything different than what we would do?
Wow, what a question. That's a great question. We've traveled to some countries that if you say the word chiropractor, they don't even know what a chiropractor is. It's not in their vocabulary. It's not in their form of medicine. Yeah. So we are in the United States way ahead with chiropractic. We have multiple schools. Chiropractic started here, but really chiropractic has been, or the mobilization of the spine and joints has been in existence for thousands of years. Yeah. But it became coined chiropractic in the 1900s, and from there it developed into a science and an art, and really has has excelled to be a premier natural health care for musculoskeletal problems. But overseas, most times what I see is graduates here in the United States relocating to Italy, to Spain, to other countries, and practicing chiropractic in other countries which are underserved with the chiropractic needs.
Yeah. Do you have any patients that come from overseas for treatment here?
Yes, we have.
You do. I would imagine Canada would be one big place, huh?
Yes, we've had from overseas, actually from the Middle East, from Europe, Canada. We've had some patients from long distances. Yeah.
So basically, stating then that that kind of treatment is almost non-existent, or if it is, it's just nowhere near the quality of care that we get here.
Yeah, our quality with chiropractic is tops here in the United States, and many countries don't have chiropractors, and if they do, it's most times that somebody graduates here and relocates over there and opens up an office over there, but probably very much underserved for the communities.
Yeah. Well, I tell you, knowing this now, next time I travel to Europe or wherever, I hope I don't throw my back out over there. You know?
Well, I'll tell you a little story. I had a rib go out in Jamaica.
Oh my gosh!
And there was only, and it's very, if anybody's had a rib go out, they know they have a hard time taking a deep breath in, and it's a stabbing pain, and it could radiate to the front, sometimes mimic a heart attack.
Right.
And so. So the closest chiropractor was on the other end of the country, and he was ready to leave back to the United States. So there I was trying to teach the hotel maid how to do an adjustment. It wasn't working. So on the public transport, and a couple hours later caught him just before he left to the airport. So you really hit home with your question.
Yeah, great question. Thank you very much. That was a great answer.
Thank you very much.
Bye now.
A rib went out. I think I saw on Facebook you were zip riding, whatever that thing is called. Is that
zip lining?
Is that how it happened?
No. This was from many years ago in Jamaica, but zip lining was right here in Ocala.
I wondered if it was.
It is amazing. I recommend you to go.
No. I'll go take pictures of you.
Will you? Okay.
Well, you did it? How fast did you go?
One spot you'll go up to about 40 miles per hour.
Oh wow!
I think Larry, I think you need to go.
You think I need to go? All right. I think
we'll put a microphone on you while you're going.
That's what you hear. Good morning. You're on there with Dr. Fakhoury.
Hello, Doctor. Good morning and Happy New Year to both of you.
Thank you.
Thank you. Happy New Year to you also.
This is Jim from Anthony.
Hi, Jim.
I'm currently under your care, and I evidently waited much too long to come see you, and one of your capable people talked to me about muscle memory.
Yes.
When you give in to stiffen up against a pain for a period of time, your muscles kind of go into like a spasm-like state. And if you don't get addressed that fairly soon, it takes much longer to get all that worked out. Would you discuss that a little bit?
I will, Jim, and that's a very good point, and that's something to share with the listeners also. And one thing that Larry and I know about is the 3-day rule. If something happens, if you're in an accident, if you hurt yourself working in the yard or feel pain, if it lasts more than 3 days, that's a good time to come in and get evaluated at the Fakhoury Medical and Chiropractic Center. Sometimes people will put it off, or they'll just deal with the pain or the stiffness, and the body starts building a shell around it, and your muscles start thinking, well, if one is tight and one is relaxed, so that way the tight muscle starts believing that that's the way it's supposed to be. It thinks that that's natural, that's normal, and so it starts developing adhesions and scar tissue in it, and it stays that way. And the longer it stays that way, it's like a child that does a bad habit. The more it does the bad habit, the more it's harder to break that habit. So that muscle is in a state that it thinks is now normal. So when that individual comes to the Fakhoury Medical and Chiropractic Center, we're working with a problem that has a lot of layers on it, like an onion. So we have to go through those layers to get to the core. We have to retrain the muscle to relax, because if the muscle is tight, it pulls the spine out of alignment, pulls the joints out of place, pinches the nerve, and causes other problems, accelerates the arthritis in the spine. So what we want to do is through our physical rehab, through our massage, through our chiropractic, try to reinstitute a more normal balance in the muscles, break that muscle memory, and with some home stretches, usually a very good job to help relieve the pain and bring that person more to a balance. But as we first started the show, where Larry said sometimes you may feel the pain today, but it's been building up over a long time, that's where the muscle memory has been building up, and all of a sudden that bone slips a millimeter, touches the nerve, causes severe pain, the person comes in. But since the problem's been there for a long time, it takes a little bit of work to undo that. That's why we encourage people to come in immediately after a trauma, after an accident, after feeling pain, because the quicker we can get it, the quicker the response, and the better the response also.
Yes, sir. That's my primary reason for calling, to address that, is to help avoid others repeating my mistake. Incidentally, I was very impressed with the thoroughness of the initial examination and the approach that your team of people went through. They all, so far, have seemed very competent and thorough in their treatment, and I'm glad we have a place like yours here.
There you go.
Thank you, Jim. Thank you for those kind words, and I'm glad we're serving you well.
I'll see you Thursday.
Look forward to it, sir.
See you Thursday. All right. Well, that's good. You know, that's kind of one of the cool things about doing a local show like this, is you get to hear from people you actually work with. You know, the muscle memory thing I can relate to with music.
Yes.
Because if you're practicing an instrument wrong, you play it wrong.
That's right.
It's amazing how your fingers don't understand what your brain wants.
That's right. Or if you pick up a golf club or a tennis racket.
Anything, I guess, right?
That's right. And start practicing without really having some training, or even get in the gym and exercise without somebody spotting you or giving you some good guidance, you'll develop bad habits, and the muscles will retain that, and it's hard to change that. So, again, the quicker we can catch it, the earlier it is. And talking about Ocala and what a wonderful place it is, and the closeness that we have in zip lining, guess what? Our instructor that was getting us through the zip line safe, first of all, their safety is wonderful. I'm going to encourage you to go, Larry. But their safety is wonderful. But the instructor, Jonathan, that was there, is a close friend of one of our rehab specialists, Travis.
Oh, really?
So what a small world. There he was, and he was actually having dinner with Travis that evening. So Ocala is a wonderful community, isn't it?
How far did you go? I mean,
it's 40? Just 5 minutes down the road.
No,
right,
but I mean, how far? The line itself.
Oh, some are very long and some are short. But see, listeners, I think that Larry is starting to think about going up there. So encourage him to go on these zip lines.
How high is it? Where are you?
We don't have to answer those questions.
All right. So you just kind of did it take any skill, or was it just they let you go and boom, it's just gravity?
They let you go, you know, that they actually train you and teach you as you go.
Oh, really?
Yes.
Are you normally athletic? Sports? Are you good at sports?
I'm good at body mechanics.
A body mechanic. So
right.
You'd be good at soccer? That's a body mechanic thing.
Yes.
You're good?
You're changing the subject, but that's okay.
All right. Now, he mentioned that when Jim said something I wanted to go back to. He said that he waited too long. He's going to see you now. And he also mentioned muscle memory. So are you, in a sense, for me to understand what he's going through, are his muscles being retrained?
Yes. It's almost like we're reconstructing, and there's 3 stages of treatment. The first stage is get the person out of pain, because once there's some relief, the person starts feeling that there's hope, that they're going to be back to the way they were. So quickly get the person out of pain. Within 3 visits, our goal is to try to get the person at least 50% better. So we want to be very aggressive on that progress. The second stage is to do the strengthening, where we do the reconstruction, where we're training the muscles to relax. And again, this is more with chronic patients or patients that have had problems for a long time, whether it's fibromyalgia or whether it's old injuries that were untreated. Let's say somebody was in a whiplash type injury, didn't get it treated, the muscle spasmed up because of protecting the body, and then never let go. And so first stage is get out of pain. The second stage, reconstruct, redevelop that spine to become healthier, and the third is to make sure it stays there.
Now, had he waited longer, or had he never gone, and I hate to use the word crippled, but would it have had a crippling effect on him?
Well, if people wait, let's say it this way: if you have a problem and you wait, an example, let's say you have a little blister, and it opens and gets a little infected. Let's say we wait a day, we wait a week, we wait 3 months, we wait a year. Well, when is the best time to get it taken care of?
Right away.
Right away,
Right
exactly.
away, yeah.
Same with the body. If your body's out of alignment, there's extra stress on your body, there's damage, there's irritation. You may not be able to see it like you can the blister and the infection growing out. However, it happens within, and it's the inflammation's in there, a destructive process starts in there, the joints get damaged, they change shapes, muscles get tight, curvatures start to form, discs start to wear out. These are things that once they're gone, we can't recover. We can help that person be out of pain and function better, but it sure is much better to get it earlier than later when the damage set in, and then it's harder to reconstruct that spine.
So I'm guessing, just from all these weeks of speaking to you, that cartilage really can't be repaired. Bone, if it's damaged, maybe, and muscles can. Is that kind of right? Muscles can be repaired?
Well, cartilage will grow back.
Oh, it will, okay.
in certain areas, but if, for example, the disc is damaged and thinned, after a certain point you can't bring that disc height back again. And so once it's thin, it stays thin. Bones, the joints, if the two bones are out of alignment and the joint is rubbing on itself, just like two pieces of wood, two pieces of metal, it starts changing the shape, so you don't have that optimum shape of the joint, and it starts to change. You might get a little spur. You can't undo that. We can still work with those individuals and help them dramatically in increasing their function and decreasing their pain, but structurally there's some damage at that point.
Okay, so everything is more fixable if you go sooner. I guess that's the lesson. Is the sooner you go, the more likely you'll be able to be made whole again.
That's correct, and you remember we talked about the 14-day law after a trauma or accident, like a motor vehicle accident. The only good side to that 14 days is that encourages people to get in quicker to get treatment, because a lot of times, especially the tough folks, and they know themselves out there.
Right.
They're the ones that hurt themselves, but they work through it, they limp through it.
Right.
Those are the people that will wait 2, 3, 4 months, and then when it's unbearable, come in, but then muscle memory set in, some damage is already set in. But the 14-day law, which allows you to be able to get care under insurance coverage in that period of time, encourages people to come in a little earlier, so our job is easier at getting them back into optimum condition. Or if there's a problem from the accident, we worry sometimes. Dr. Shanawani, our medical doctor, is making sure that there isn't any type of medical conditions with head traumas and things of that sort. So the quicker we can get those and evaluate those and refer them out in those cases, rare instances, but we are equipped to look for those and get those taken care of. The sooner the better.
And I'm guessing the better relationship you have with somebody prior to an accident, the more likely you'll be able to see how much damage the accident caused. If you didn't know what I looked like before the accident, you wouldn't.
That's
really.
An excellent point. That's an excellent point. And there's one patient that was in a very bad accident. God bless her. And she came in, and I saw her just on Monday. I saw her, and I've treated her and her family over a period of time of maybe 23, 24 years.
Oh, okay.
And her comment was exactly that, because I could feel the change in her neck, and we could discuss it together. And she's a massage therapist, so she knows how the body works, and we discussed that, and she said those very words. I'm glad that I was here before, so you know the difference now compared to then, because that's very important in the treatment, because we know where we want to be, because we have some experience prior to that.
Yeah, and I'm guessing it's going to be more essential now because of that 14-day rule. If you have to have some way of proving, I guess now, to your insurance company that you were hurt. I mean, what if they don't believe you?
And that's an important point, and that's where our medical records come in to clarify what's related to the accident, what's not related to the accident, because we have to be fair to the patient, we have to be fair to the insurance company, we have to determine and treat only what's related to the accident in those scenarios.
It went fast. Wow. Was it really half hour?
Time flies.
Is time in 2013 moving quicker?
No. Let's not say that.
Yeah, we don't want that to happen. All right. Well, Happy New Year.
Happy New Year to you, Larry.
In 2 days into it. So far, so good?
Oh, it's going to be a beautiful year.
So do you have any resolutions?
More flexibility, improve functional structure, just enhance the health.
You're the king of flexibility. How could you have any more? You run down those stairs like you're 18.
Thank you.
Okay, what's the phone number over at the Fakhoury Medical and Chiropractic Center?
The number is 351-3413, and extension 4 will take you directly to the front desk or to our patient care coordinator. If you have any questions for them, please feel free to ask. They'll help you. Or else if you need to schedule an appointment, they'll schedule you immediately to get evaluated by one of the fine doctors that we have.
There you go. And Dr. Fakhoury's office is at 1009 Southwest 16th Lane here in Ocala, right over the bridge on 17th. It's called Governor's Bridge.
That's exactly right. And to practice, we're going to put a line from the bridge down to the clinic and let you zip line on that line from the bridge to the office.
Oh, yay.
just to get you started. But I think the listeners should encourage you to try to zip line.
I don't know about that. I don't know. Thank you, Doctor.
Thank you, Larry.
We'll take a little break and we will be back.
Hello, this is Dr. Riadh Fakhoury, chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Listen in to the Head to Toe Care Show every Wednesday, 11 a.m., right here on WOCA. Learn how your body works so that you can help yourself. We're available to answer your questions every Wednesday at 11 a.m. on WOCA, The Source. That's Dr. Riadh.